Here are some pointers that you must take note of after your operation to prevent infection and injury to the eye. Before discharge, you will be prescribed eye drops by your surgeon. Post-operatively, antibiotic and anti-inflammatory eye drops are commonly prescribed. Eye drops are to be used for 1 month unless you are advised otherwise. Oral paracetamol will also be given for pain management unless contraindicated. 7 packs of sterile, one-time use cotton balls and normal saline will be provided with the eye drops. The cotton balls and normal saline are for cleaning your operated eye. You are required to clean your eyes for 7 days, once every morning. By maintaining cleanliness, the risk of eye infection is reduced. After the surgery, a plastic eye shield will be used to cover your operated eye. This is to prevent you from rubbing your eyes and causing injury. You are required to wear the eye shield for an entire day after the operation and subsequently only when you are asleep. The shield may be washed using soap and water. To avoid the glare of the sun when outdoors, you are advised to use sunglasses for 1 week or longer if you are light sensitive. Please do not use sunglasses when you are indoors or in dark areas, as it may cause you to fall and injure the eye. There is no food restriction after the surgery. You are advised to continue with your usual diet. However, you may choose to abstain from food based on your beliefs. You are not required to fast before your next day appointment unless otherwise specified. You may perform simple cooking such as boiling, but it is advisable not to fry dishes as it may cause oil splatter and increase the risk of injuring the eye. Do not use goggles during cooking as it creates pressure around the eye. You may continue doing near or distance work such as reading, writing, needlework, watching television, and working on the computer. Remember to take breaks so as not to overstrain your eye. If you do gardening, you may continue to water your plants without straining yourself. To prevent infection, do avoid touching soil for 2 weeks and to wash your hands with soap and water after watering your plants. You may travel after the surgery, but do discuss your plans with your doctor in order to facilitate arrangement for post-operation reviews. Typically, you are required to come back for an appointment 1 day after the operation and 1 month later. Your doctor may arrange for you to come back in 1 week's time if your condition requires monitoring. If not, a nurse will call to follow up on your condition. Once your vision has stabilized, this could be 1 day after surgery, until your vision is clear or as advised by your doctor, you may continue to drive. You may shower after the operation, but it is important not to splash water directly into the eye. Lower the shower head while bathing. To bathe from your neck down. To wash your hair, it is advisable to sit down on a stool and tilt your head backwards while washing, or consider going to the hair salon. To reduce risk of infection, please do not apply eye makeup for 1 month and avoid splashing of tap water directly into the operated eye for the next 2 weeks. Avoid rubbing your eyes for 1 month to prevent risk of injury to the eye. You may consider wearing the eye shield for the whole day if you have the habit of rubbing your eyes. You are advised not to wear your spectacles or contact lens on your operated eye, as there may be a change in your eye's degree. Your doctor will do a vision check during your 1 month post-operation visit and advise you on the appropriate eye prescription. Meanwhile, if you need an optical aid for daily activities, you may consider wearing contact lens in your unoperated eye or spectacle lens with no degree on your operated eye. You should refrain from participating in strenuous activity as it may cause a build-up of pressure in the eye and risk injuring it. This includes avoiding activities such as heavy lifting for 1 month and physically demanding work for 2 to 3 weeks. During your eye's recovery, avoid carrying young children who may unintentionally poke your eye. Please avoid water-based activities like swimming for 1 month after your surgery. For safety reasons, do not exercise and avoid sports activities for 1 month. You may continue light exercises such as strolling. After the surgery, you may experience blurry vision, excessive tearing, sensitivity to light, itchiness, or a sticky and gritty feeling in the eye. The eye may be red with aching experience over the eye socket area, bruising of the eye or eyelid. There may be occasional flashes and floaters. These are commonly experienced after an operation. However, do take note of the 4 following post-operative complications that may occur. It is important to inform your doctor if you experience any of them. Firstly, a sudden increase in floaters or flashes. Secondly, excessive pain in the eye that is not relieved by medication and is accompanied by headache, nausea, or vomiting. Thirdly, decrease in vision as compared to before operation. And lastly, excessive discharge from operated eye that could be an indication of infection. For answering services, please call 6532-4865. For change of appointment date or for repeat medication prescription, please call 6227-7266. Thank you for choosing Singapore National Eye Centre for your operation.